Hello, Victoria here. So today you get to see my own core therapy treatment. Please subscribe to see all the different therapies on this channel. There's all manner that are already loaded and I will be posting over the next months. So today is mine. Wow. So the tables turn, literally the therapy table turns. And it's not in the bothy today, but it's in my lovely friend Vanessa's therapy room in her garden in Oxfordshire. And you see us have a little chat at first, so you can see us without masks on. And then she gives me a lovely part treatment. Next week you get to see the second part of this treatment. Vanessa has a particular style which is a little bit different to mine. We're all completely different, and she has such a talent that I ask her about, so watch for that chat and watch to the end to see whether I'm moving well at the end of my treatment and how I react to my first part of the treatment. And I'll see you again next week. Let's spread a little healing, guys. Please subscribe. Okay, Victoria here. I'm just about to have my own core therapy treatment with lovely Vanessa, my good friend of the last 3 years, I've just realised, of swap core treatment. And so I've just driven over to her beautiful house in Oxfordshire and looking forward to having a treatment. So, hi.
Hi.
Hi. And so you probably want to know what I'm presenting today. So I've had a little bit of an issue with a tooth, so you might want to look at my jaw and my alignment. But obviously every core treatment is completely different, so you're working on kinesiology. Let's see what comes up. I've also been aware, because it's been about 2 months since our last swap, that my left side ipsy, so the sacroiliac separation, it's not hurting. I'm just aware of it, and I think, get that seen to straight away.
Before it becomes a problem.
Yeah. So check me out. I probably could do with a bit more sleep, and I'm working really hard, aren't I? Yes. Yeah. So I'm doing long days.
Okay.
Anyway, so Vanessa has a beautiful style that is a little bit different to mine, you'll notice. And obviously every core treatment is different anyway. It depends what presents, and different core therapists will have their own go-to therapy techniques. So Vanessa has a beautiful technique that's slightly different to mine. Do you want to tell me about it?
I probably go, it's more Qi Gong than probably how you work, but mine's more Qi Gong, more energy. It's more about of a feeling that I have, a sensation, and I just know where I want to go and need to go to give you the best treatment, if that's...
And something happens, doesn't it?
Yeah, I just get heat in my hands, so my hands will go really hot, and occasionally they will sort of give me an even bigger nudge and give me a shake and say it's really out and this needs work. And it's an energy release. It's more of an energy with me than anything else, I think.
Wow.
Yeah, and sometimes we'll see colours.
Wow.
So yeah.
So when there's some movement in your hand,
Yeah.
when you're working on someone,
Yeah.
what does that mean?
It means it's out and it needs that release, that there's a block that it needs releasing and allowing the energy to flow through the body.
And when does your hand then stop when
Yes.
when it's done its work? And
Yeah.
do you not move on until
And I
it's...
know when it's, I obviously say to myself when it stops, I know I need to go on and do to the next stage.
That is amazing.
Yeah.
You've got a gift.
Very different, probably a lot different to a lot of core therapists. Probably.
Good for you. Go for it.
But I'm an acupuncturist as well, so
Of course.
So the Chinese side of it comes in quite a lot.
Yeah. Oh, there's a pigeon squabble going on. I get a lot of that as well. So I'm really looking forward to this, and let's see what comes up in the treatment.
Okay, let's go.
So join us in the therapy room of Vanessa's beautiful garden studio while Vanessa is treating me for a change. So first of all, she's just looking for an SIM, which is a strong indicator muscle. She's checking some limbs individually and trying to find one that she will go to when she's testing my joints and hips, etc. This is an IPSI test, my right side and my left. And normally my left fails, but it seems to be passing today. Now a contralateral test, both sides, they're passing too, which is again most unusual for me. She's just having a feel at my IPSI joint, which, as you saw in the intro, I had felt a little bit of discomfort with recently, even though the test had passed, so it can't be too bad, but I was just aware of something. So she's just having a feel to see what it feels like to her and whether it was painful for me. This is a psoas test, so testing the psoas muscle in the pelvic area, which actually tells her about my neck and my mid-back. Again, I normally fail both of those because of a tight upper neck, and indeed today they passed. Again, most surprising. And she's now doing a latissimus dorsi test, which is that huge muscle that wraps around the main part of our back. And that passed. I'm normally quite strong with that one. So that was good. And now I'm just having a look, or Vanessa's just having a look at my ICV, which is a digestive area called the iliosacral valve, and that was good as well. We always test the ICV in core, whether people have digestive issues or not, because it's such a regular area of discomfort and causes of problem with all manner of issues in the body, not just digestively. Now she's working on an area just below my left knee on the inside, which is incredibly sore. She's an acupuncturist as well as a core therapist, so she knows exactly the acupuncture point on the meridian to press. This is a spleen point. She's pressing really firmly with her thumb into a certain point that probably shouldn't be painful at all, but in myself it was so sore. So this tells me I need to be pressing that more often in order to get rid of the restriction in that meridian. It needs to flow. You know, Chinese always talk in their TCM, traditional Chinese medicine therapies, that the most important thing is flow, and where there's pain, that means there is a lack of flow. So she's just showing me the point underneath the knee that I need to be pressing in my own time between my core therapy treatments. It's incredibly painful when she presses it, and I have told her to carry on. I'm trying to be very brave. And this I know will, yes, it'll help my meridian and my spleen, but it will also help my knee, and that's why she's gone to this place. Because over the last few months I've noticed my knee clicking, occasional little bit of pain or lack of smoothness in bending and releasing my knee. So that's why she's looking at this area. I am left-handed, so maybe I do tend to put more strain and pressure on that left knee. So I'm hoping everything that she and I are doing will be helping my knee. It's certainly not failed me yet, so I feel in trust of Vanessa's care of me. It's a nice feeling. Now she's doing a glute max test. I sometimes am quite strong with this. It all depends. Yeah, that's quite a strong test. And that would show whether my lower back, about L3, so in the lumbars, or my upper neck at about C2 would be restricted and tight and causing me to fail that glute max test. Actually, they were strong, but the reason she's just had a little inspection of my left glute max is because of the pain that I mentioned in the chat at the start with Vanessa that I had felt in that sacroiliac left side. So she was just having a little feel and mobility movement like that to see if there is tightness. Quite often when we're doing the Tuina, that massage rocking movement, we feel tightness in a muscle or restriction in the vertebra, and that's why we will make sure that we concentrate on that area and around it when we're working. Vanessa's just completed 4 areas of kinesiology testing around my sacrum. So I call it the north, south, east, west testing, each point of the sacrum, by using my little finger and thumb as a strong indicator muscle. Now she's working on my shoulder. She's now giving me some Tuina, which feels amazing. I obviously have quite a physical job. I work for many hours a week doing exactly what you can see Vanessa doing here on my clients and on my family and friends. And so it's quite right that all therapists should get a good checking therapy, but also a treating therapy as regular as possible. Vanessa and I swap about every 5 weeks. It's been a little longer this time. It's been about 8 weeks between treatments, so I realise that my body definitely needs a little TLC. And by using her base of both hands, she's moving into my vertebra, and at the moment she's checking each one. She's having a feel for whether it moves under her hands. She's got a nice firm touch here. This feels great, a nice rocking sensation. As I normally refer to, it feels like you're being sent back to the cradle. It just feels right. This is a lovely technique where she's pushing up with one hand on the fascia between the spine and the scapula, and down with the other hand, pushing the deltoid, the shoulder point, downwards towards my feet. So that twisted maneuver helps to really relieve the muscle, ligaments and tension between the spine and shoulder blades. It really helps you to lower your shoulders when you're sitting, standing, working, etc. Having given me a full Tuina, she's now doing the drunken walk with the heels of her hands up and down the back to about the lower thoracics, which meet at the base of the ribs. And where there's tension, she gives a little bit of extra soft tissue release. Oh, this is great. She's giving me a little bit extra today. She's working on my calf muscles. Now, this is because she's wondering if my knees are tight because of any strain in the muscles around it. So whether that's the hamstrings at the back of the thigh, whether it's the large calf muscles, the soleus and gastrocnemius. And now she's working on my left side. This is where the knee was restricted and has been giving me a little tweak occasionally. So she's having a feel for where the tension might lie that might be causing that. She's working nice and firmly. Now, I don't know about you, but calf muscles can be quite tight without us having any awareness of it. If you were to feel into your calf muscle now with your whole hand or with your fingers, you may notice some tension there. The calf can hold on to a lot of tightness and strain. Maybe we're on our feet a lot, like I am. Maybe we're tensing them without even knowing it. Now she's found a couple of points within my calf that are particularly sore. She's using her thumbs as well, and she's rolling my calf muscle inwards. And now she's got her thumbs in a particular point. Now actually, as I just talked a little earlier about each muscle having a origin and insertion, which is a foot and a head, then actually with this muscle down here, it has 2 feet and 1 head. So actually there is an upside down V-shaped gap at the base, lengthening up through that soleus muscle. And so toxins can easily get trapped in that little V. And without a massage or really good stretching, yoga, Pilates kind of movements, then they will sit there happily for a very long time, eventually causing much tightness and maybe even issues, maybe not even in the leg, calf itself, but as I'm starting to feel, maybe in the joints around it. It's interesting, sometimes joint issues aren't necessarily because of the joint itself, it could be from the muscle tension around it, pulling and twisting that joint to create torsion, so that when we're walking we're not aligned correctly. And that is only going to make huge problems, unfortunately, for that poor joint. Now again, today Vanessa seems to have a nice firm touch for me. She's put a lot of pressure on that calf, which if you could have heard me, you'd have heard me yowking and yikesing all the way through that. Oh, now this is beautiful. She's now doing a wing stretch, which pulls the scapula away from that upper back, bringing relief and loosening any tension. Doing the same to my right side. Giving me a little shove, making sure the fascia is released, the muscles are reminded to let go. Lowering the couch. so that she can insert her knee underneath my lower leg, ready for a foot repatterning. Vanessa is also a reflexologist, so she knows all the points to press for the reflexology point meridians, and then a nice foot release, which actually relaxes the ankle, the Achilles tendon, and the lower leg. Vanessa's got a lovely touch on the feet. It's so relaxing. You know that you're in good hands when you're having a lovely core therapy with Vanessa. Just to let you know at this point, Vanessa hasn't got a full visor on. She's wearing a mask, but her visor covers the glasses that she's wearing. And now that lovely leg repatterning, where you can see my opposite hip raising. It's a really good angle of this camera to see that here. And what that does is it realigns the pelvis so it's in the position it should be in, not the way that our life forces it into. The same on the other side. Beautiful foot treatment while she's inserted her knee underneath my lower leg, rotating the ankle. You see, all the time as core therapists, we're reading, we're listening, we're looking for where needs extra attention, even if it didn't come up in the original kinesiology muscle tests. Even when we're giving the treatment and therapy, we're always looking and listening, working out where else needs help. Raising that opposite hip. Beautiful. Now she's looking up to make sure that I'm balanced in my posture. And now a lovely sacral float. This is the Qi Gong. Beautiful healing treatment. One hand on top of the other on my sacrum. Sacrum is almost the very lower part of the spine. You'll notice that she's got a good posture herself. She's relaxed her shoulders. As therapists, we're always mindful for not having our shoulders up by our ears when we're working. We're trying to look after our own health. And the colours I'm experiencing now are the most amazing purples and pinks. I see all manner of colours when I'm being treated and also when I'm treating. But at the moment I'm seeing a magenta. And the magenta is not one solid colour, it's lots of different layers and tones. Now she's moved one hand to my occiput, the back of the head. The heat is incredible at this point. And what she's tuning into now is the lengthening of the spine. And when the energy releases, it feels beautiful that actually the spine just lets go. And suddenly you can feel it as a therapist under your hands. It just lengthens. You feel quite humbled to be a part of someone's releasing someone's energy in that way. beautiful feeling. You might want to take a few deep breaths now to tune into the same energy. Vanessa's such a good therapist. She's really helping me right now to lengthen my spine, to relax my body, to tune into and accept my own energy. When her energy raises, when there is a blockage, her hand tends to move and shake. And there is a little movement going on now. You can see my hair moving, where she's really tuning into my energy and allowing me, just accepting and allowing. That's such a deep, wonderful talent to have. I'm so grateful to her at this moment for giving me the time to help me heal, to help my future self. And once she has finished this particular part of the treatment, she'll be moving on to more Qi Gong, which will be brought to you next week. She'll be working on my body once it's turned over. She'll be looking at the alignment and then working on my neck release and my cranial balancing. So thanks for joining. Please join me next week to see the second part of my treatment. Also, please subscribe. Let's spread a little healing, guys.